Hello NEET PG aspirants, welcome back to the PYQ series. In this video, I'll be discussing a PYQ asked on viral meningitis. So without wasting any time, let's start with the video. So I am your guide and mentor, Dr. Amit Kumar Singh. You are watching Microbiology Simplified. So today's topic is viral meningitis, PYQ number 4. So the MCQ is a 25-year-old male presented with a history of fever, headache, neck rigidity, and erythematous rash on the upper body. He don't have any history of travel or mosquito bite. CSF examination showed raised protein, normal glucose, mild pleocytosis with predominant lymphocytes. Which one of the following is most likely organism? Okay, so let's see what are the information given in the question. First is the history of fever, headache, neck rigidity. So this indicates, these symptoms indicates that the disease is probably what it is meningitis. Okay, and there is also history of rash on the upper body. So this is a case of meningitis with rash. Okay, and he also don't have any history of travel or mosquito bite. Okay, so this has got importance. We'll see later. And then CSF examination. So raised protein, normal glucose, and mild pleocytosis with predominant lymphocytes. So protein is raised, glucose is normal, and mild increase in WBC count, and predominantly lymphocytes are present. So if you have gone through the previous videos, you must have learned about the various CSF findings of various type of meningitis. So what it could be: increased protein, normal glucose, and predominant lymphocytes, and mild pleocytosis. So it indicates what? Viral meningitis. Okay. So just a quick recap of that table once again. So what we will see in viral meningitis, the pressure is usually normal to elevated, the CSF is clear, and WBC is elevated. But if you see, it is not too much, it is only mild, similar to tubercular and fungal. Okay. And then the predominant lymphocyte, predominant WBC is lymphocyte. And if you remember, I told you that neutrophils may be seen during initial 6 to 48 hours of infection. Okay, neutrophils may be seen during initial 6 to 48 hours of infection. This could may extend to up to a week in case of which infection? Infection caused by which virus? It is meningitis caused by virus, that is West Nile virus. Okay, in case of meningitis caused by West Nile virus, we may see a neutrophilic picture up to a week before shifting into the lymphocyte. Okay, and then again the protein may be normal to mild elevation. It is not too much, it not greatly increased, and glucose may be normal, but it may be low in case of meningitis caused by lymphocytic choriomeningitis virus, and another virus is mumps virus. Okay, and then lactate is almost normal or slightly decreased. So these are the pictures which we can see in viral meningitis. So on the basis of this picture, what we can say that the question is about viral meningitis. Okay, so we have to see that which are the viruses which causes meningitis along with rash. So among the given option, what we can see, the first two options are bacterial agents, meningococcus and pneumococcus. Okay, meningococcus and pneumococcus. So this is clearly out of the scene right now because the CSF examinations is nowhere close to bacterial meningitis. So these two are out. But what we should know that in case of meningococcal meningitis, we may see rash. So it is a bacterial cause of meningitis with rash. Okay. Then now the other two options are Westnile virus and enterovirus. Now in both these cases, we may find rash. So rash may be present in the meningitis caused by both of them. So then what should be the answer? As the patient has given no history of mosquito bite or travel, as Western virus is endemic to certain areas, so there is no history of travel or mosquito bite because the mode of transmission of Western virus is through mosquito bite. Okay. However, the enterovirus is transmitted through contact with infected secretions. Okay. So that's why this is also out. So what should be the answer on the basis of this is enterovirus. So the correct answer is enterovirus. Okay. So this is the way to answer or approach such type of questions. Okay. So this is done. But if you want to learn more about the causes of meningitis, viral meningitis and meningitis with rash, both viral and bacterial, then stay with me. So there are so many causes of meningitis. Some of them are considered major, some of them are considered minor. But remember, these major and minor classification is not very strict. Okay, you may find in some of the research article or textbook that whatever I am saying as minor may considered as major cause of meningitis. So it varies from area to area, geographical location. It may vary. So that's why I'm saying. But yeah, what is important to know that these are the total list of meningitis causing viruses. Okay, so the major cause overall, if you see, the major cause of viral meningitis is enterovirus. Enterovirus are the commonest cause of viral meningitis, and the most common among enterovirus is ecovirus and coxsackie virus. Ecovirus and coxsackie virus, these two are the most important cause of viral meningitis. Enterovirus 68 to 71 are also known to cause viral meningitis. Apart from this, herpes simplex virus 2, HIV are also known to cause viral meningitis. Among arbovirus, if you'll see, the flavivirus, Bunnia virus are known to cause viral meningitis. Among flavivirus, West Nile virus is very important virus, and then Zika. These two are very important, and some of the non-Western arboviruses are also known to cause viral meningitis. Among Bunnia virus, California encephalitis virus, apart from causing encephalitis, causes meningoencephalitis. So it involves both meninges and the brain parenchymas. Okay, and then lymphocytic choriomeningitis virus is again an arbovirus which commonly causes viral meningitis. Some less common causes of viral meningitis are herpes virus, which include EBV, HSV1. So HSV2 is a common cause, HSV1 is a less common cause. Human herpes virus 6, CMV and VZV. So all these are known to cause meningitis. Apart from these paramyxoviruses, measles and mumps are known to cause viral meningitis, and some of the adenoviruses found to cause viral meningitis, but very rarely. Okay, so this is the exhaustive list prepared from various articles and textbook. So there is nothing beyond this. So if you remember this list, you will be able to answer all the question asked on viral meningitis. Okay. Now coming to the meningitis with rash. So if you see, there are certain viral agent which causes meningitis with rash and the certain bacterial agent which causes meningitis with rash. So among the viral agent, if you see, again the commonest or the major cause of meningitis is still the cause of meningitis with rash. So what are those? Eco and Coxsackie, and in both of them we will see maculopapular rash, and there is also a history of fever in case of ecovirus infection. Okay, so both eco and coxsackie virus, which are the commonest cause of viral meningitis, are known to cause rash along with meningitis. So this is an important cause of meningitis with rash. Okay, then West Nile virus also known to cause meningitis with rash along with Zika virus. So almost all of them are known to cause which type of rash? Maculopapular rash. Okay, and then In bacterial, if you'll see this meningococcal meningitis and leptospirosis, these two are known to cause which type of rash? Petechial rash. Okay. Petechial rash are common in this meningococcal meningitis and leptospirosis. Leptospirosis is a bacteria which is known to cause very commonly aseptic meningitis. Okay. And among rickettsial infection, if you see, these three are known to cause meningitis with rash. And what are these? Rocky mounted spotted fever, human monocytic ehrlichiosis, and human granulocytic anaplasmosis. This rocky mounted spotted fever, what we can see eosinophilic meningitis. Eosinophilic meningitis is commonly caused by helminths. Okay, eosinophilic meningitis is commonly caused by helminth, and the most common helminth which is associated with eosinophilic meningitis is Angiostrongylus cantonensis. Okay, Angiostrongylus cantonensis is the most common helminth associated with eosinophilic meningitis. Apart from helminth, there are certain fungus, certain bacteria also known to cause eosinophilic meningitis. But if in the question it is asked about the most common cause, then the most common cause is helminthic infection, and the most common helminth is Angiostrongylus cantonensis. Okay, and this human monocytic ehrlichiosis, this is caused by Ehrlichia cephiniensis. Okay, and this human granulocytic anaplasmosis, this is caused by Anaplasma phagocytophilum. Anaplasma phagocytophilum. So what are these two? These are two Ehrlichia infection, and the basic difference is the involvement of the WBC. In this, monocytes are involved, in this granulocytes are involved, and what we will find? We will find these bacteria inside these white blood cells. Inside monocyte, we will find this Ehrlichia cephiniensis, and this inside granulocyte, we will find Anaplasma phagocytophilum. And how they will look? There is a question asked in INI-CET that, I'll just change the color of the pen. Mulberry or rickettsial morula is seen among. So rickettsial morula in case of monocyte is seen in HME, and rickettsial morula in case of granulocyte is seen in case of HGA. Rickettsial morula inside granulocyte is seen in case of HGA. And what is this rickettsial morula? This is nothing. This is cluster of these intracellular bacteria. Okay. So this was asked in INI-CET. Remember this rickettsial morula. Okay. Now see the vectors of arboviruses. So as I told you, that West Nile virus is caused by a mosquito. So which mosquito is known to transmit or act as a vector for West Nile virus is Culex. So let's start with Aedes. So Aedes, if you see, these four are known to cause viral hemorrhagic fever. So viral hemorrhagic fever is usually transmitted through Aedes. Remember like this. This Chandipura virus is known to cause encephalitis, and then this encephalitis causing viruses like JE, Murray Valley encephalitis, St. Louis encephalitis, and West Nile also known to cause encephalitis, and commonly meningitis encephalitis, and this St. Louis virus is known to cause again hemorrhagic fever. So these four which causes encephalitis is transmitted by Culex. So remember, most of the encephalitis virus is transmitted by Culex, and most of the hemorrhagic fever viruses is transmitted by Aedes. However, there is an exception that this encephalitis virus is transmitted by Aedes, that is Chandipura, and this hemorrhagic fever virus, hemorrhagic fever causing virus is transmitted by Culex. There are certain viruses which are transmitted both by Aedes and Culex, and these three are known to cause encephalitis, and this is known to cause hemorrhagic fever. So this is transmitted both by Aedes and Culex. So remember this: Eastern equine, Western equine, and Venezuelan equine transmitted both by Aedes and Culex, and chikungunya is also transmitted both by Aedes and Culex. Difference is that the first three known to cause encephalitis, chikungunya is known to cause hemorrhagic fever. Anopheles is known to transmit Ong virus, okay, and then tick-borne. Tick-borne, the viruses which is transmitted are Colorado tick fiber virus, KFD virus, Omsk hemorrhagic fever virus, tick-borne encephalitis virus, and Crimean Congo hemorrhagic fever virus. Okay, so these are tick-borne arboviruses. Okay, so now you have got the list of viral causing meningitis, viruses causing meningitis, list of viruses causing meningitis with rash, list of bacteria causes meningitis with rash, and then the vectors of various arboviruses. So make a note of it, remember, read it 2 or 3 times, and then you will be able to remember it. So and you will be able to recall it during the examination. Okay, so I hope I was able to explain the topic. See you in the next PYQ video. All the best.